Hello everybody, welcome back to another video. This is Mal, and today is going to be a mix of two videos type thing. Instead of reacting to TikToks primarily or for activism content, I'm kind of going to be mixing bigger discussion points with a few sources, a few TikToks that I've seen that brings up good topics or things that I think do need to be talked about when it comes to health, every size, for activism, for acceptance, and all the many names and guises under that kind of thing. So yeah, let's get straight into it. I just wanted to have like a little time before we react or essentially discuss the first bit of content. I'll just state where I stand. In terms of fat activism and body positivity, I see them as two different things. I do not think they are the same thing. I believe fat activism, basing it on what activism really means, I see fat activism as an action or a vigorous action that brings about a form, that brings about a reform, is what I mean. So an action that brings about some type of reform in order to base society around bigger bodies or fat bodies. That's what they're going for there. So that is a growing community of change, I'd say. And body positivity is an acceptance and appreciation of all bodies, and that's regardless of shape or size, weight. It also includes skin, gender, physical abilities, and disabilities, and that's a bigger community of all people. Yeah, that's what I see as body positivity is. I separate that from fat activism. I think there are some overlap, but I think fat activism is using body positivity as a guise for this kind of health every size want of change and reform in societal standards. So they're trying to merge these things together, and I just don't think they're the same thing. I think they're completely separate things, which is why I try not to say body positivity when I talk about fat activism. And I know it's confusing because there's so many terms. I think fat activism, it does kind of it is the more accurate term because they are trying to engage in this vigorous action to bring about some form of change. So that's what I agree with there in terms of what I call this movement per se. And I think there's many contradictions in the fat activism community. My stance overall is I think any body is a human body and is acceptable, but certain behaviours aren't. That's where I stand. I think every single body, I think every body, as in everybody, and every single body separate should be respected in its own way. I think we need to have respect for each other as humans, but I think there's a separation between the human body and then the behaviour. So that's what I mean. That's where I stand. I disagree with a lot of the things that fat activism in the movement that they're saying, and there's some things I do agree with, or I think is up for a bigger discussion and has some positive things in there. But overall, I disagree with a health every size quote unquote topic. So yeah, that's kind of where I stand. And I guess at the end of the video we can talk about a bit more about what things I hold accountable in terms of this movement. But let's get into the first thing. I do have all the papers and stuff that well, she references one paper and it's here, and I have gone through it. I have had to kind of go in a roundabout way of accessing it because I didn't want to sign up to this, and the other, and pay for subscription, whatever. But I managed to find it, and I've been through it, and we'll talk about it after. But first of all, let's just hear this person out. This is Whitney, and the video is called "My Roman Empire is Health Every Size and Fat Activism Movement." And I do believe she is a dietitian. I think she did say dietitian. So we'll just watch this, and then I'll react to some of the things she says, and then at the end of the video, I'll get into the actual argument.
Roman Empire is and always will be health at every size in the fat activism community, fat activism in general, because becoming a dietitian, getting into intuitive eating, like body image healing, eating, and then really digging into the research around obesity. I hate that word, but fatness.
So she talks about hating the word obese, and that's the very common thing I've noticed. And actually, one of the TikToks we will be reacting to references this as well. So I just thought I'd bring up that's one of the things we'll talk about.
And like what the health research actually says versus what we have been lied to about it.
Right. First of all, this paper that she is referencing, that it's not a paper. It's not a research study. Well, it's not a research study. It's not an original research study. It is an editorial commentary, similar to what I'm doing or what other reaction channels do, and similar to what this lady Whitney here is doing. It's an editorial commentary. It's not a research study at all. Yeah. So just to let you know, that's what that is. It is not research.
Broke my brain. For those who don't know, Health at Every Size is a movement within healthcare to challenge.
Not really within healthcare. They kind of that primarily could have been how it started, or that's kind of the more serious area or topic that these fat activism, health every size community dig into. But it overlaps in other areas such as food and eating and stuff like that, exercise. There's many different forms that it takes. So it's not just in healthcare. They're not only looking into healthcare. Obviously, I talked about the fat activism trying to bring about some reform or some type of base where society revolves around bigger bodies. So yeah, it is one of the more serious areas, but it does not stop there. It has other things, and the other things are the things that we, and when I say we, I mean people who have a similar stance on health every size as I do, are the things we criticise. The healthcare areas, it does have its toxic bits and its things I disagree with, and some things that are not based on facts and is just purely a opinion, and wrong. But there are some big areas that are actually quite valid and quite positive, such as weight bias in healthcare. So, there are some good things, but the majority of the things I hear and I see are very much not based in fact and are a bit of a cope. Might I add, but there are definitely some points that these fact activism people and community make that are valid. So we'll discuss them later.
The assumptions that weight loss is the answer and that body size needs to be fixed by weight loss and is possible to be fixed by weight loss. Oh, being fat kills you, you get all these diseases, whatever. Do you want to know what really kills you?
Well, first of all, yeah, it does. I mean, do you see many, if any at all, people over the age of like 80 or 75 who are extremely obese? I'm sure there are some, very rarely, but there are some. But I don't think it's something you see every day, is it? And there is actual research to prove that there are a multitude of diseases that is caused by obesity and immense weight gain. And well, actually, we're going to go into the term obesity, but there is a video that talks about it later, so I'll save that for then. Let's continue.
Fat phobia, stigma. Do you want to know what else?
Oh yeah, for sure. Stigma is definitely a barrier in terms of healthcare. And again, there's a video that goes into that, so I'll save that for later. For now, I just want to talk about the paper and just react to Whitney. But for sure, that is one of the very valid things that they argue.
Is like diabetes, the cardiovascular conditions that are usually associated with being in a bigger body.
Not just associated, it's the main cause. The main cause of diabetes, type 2 diabetes, is obesity. So there's not really much room for stigma there because it is the main cause. That's where I stand there.
Stigma.
And let me just mention my father, who had cancer and unfortunately passed away last year. He did have type 2 diabetes, and that was actually a mix of multiple things. That was a mix of his diet. He loved his sugar, he loved his chocolate. He was a sugar addict. Okay, I admit that. My God, he loved his sugar, partially because of his diet, but also another factor was the steroids that he was on due to his cancer. So for sure, there are areas and factors that contribute to diabetes that aren't to do with obesity and weight, or poor diet. Really, the thing with diabetes is the diet, the lifestyle, and the things you are eating. So there are other factors, but primarily when we're talking about the majority in the research, it is obesity and the behaviors around obesity that cause the diabetes in that person. Genetics involved for sure, but she's kind of grasping at straws a little bit.
And weight cycling, okay, dieting on and off in the pursuit of weight loss. The more you weight cycle and diet on and off throughout your life, the worse your health becomes.
Oh, for sure. Like especially with hinge eating and the kind of weight cycling and diet cycling associated with that, you are spiking your blood sugar so much and it has to come down, and that kind of up and down can cause diabetes. Now again, you don't have to be obese, but that is the food aspect, that's the diet aspect around that. And when I say diet, I don't mean as in when you're in a calorie deficit. When I say diet, I mean what the actual word diet means, which is your eating lifestyle, the way you eat. That's what I'm saying, by the way, just so there's no confusion. And yeah, of course, the way you eat, there is a stigma about the way you eat and your weight, weight bias. There definitely is that. But she's kind of there's some areas where she kind of starts to make a good point in a way, but then she kind of lacks anything to fall back on. But we'll continue.
Decades of research that like traditional approaches to weight loss don't work in the long term.
Can you give them to us? Because at the minute you're showing this, and that is not research, that's a commentary paper.
And we're talking.
You're showing this, and that is not research, that's a commentary paper.
And we're talking 95 to 98% of people regain the weight within 2 years, if not more.
Oh yeah, right? If you're diet cycling, then for sure, because you're not making a lifestyle change. They are literally using the wrong meaning of diet there. They're going up and down, and that is caused by society and social media in general. The things that are being pushed in order to make a profit, for example, like Atkins, I think it's called, something like that. In Korea, South Korea, there was a very big one, like the apple and rice porridge diet. That it's just taking products or small foods, I mean limited foods, sorry, not small foods, but limited foods, and then obviously you're going to lose weight because you're starving your body of its essential nutrients and stuff. But as soon as you have a regular eating lifestyle, a regular diet after that, you're going to put that weight back on, obviously. That's why I advocate for lifestyle changes, making small swaps for the better. If you make small changes in your diet, in your lifestyle, you have massive benefits, massive changes. Really small things can affect in a big way. A bit like the butterfly effect. You step on a butterfly, you can change the trajectory of everything. You can change massive events in the future. I see it in a very similar way. You make one small change with very big outcomes.
Now, when we look at that, for decades now, this weight loss research has said, we need to look at that 2 to 5% of people who are able to keep it off because like they are the answer. Or
I'm struggling with the fact that she's not really providing anything here, but it's So I think what she's saying is, sorry, I've not watched the full thing. I've just watched a little clip and then I've gotten the paper and then I've gone through it. So I've not watched the full clip. I think what she's saying is that the weight loss kind of research that's been done positively enforces their argument using a very small percentage of people that have succeeded, the 5 to 8% who have kept the weight off after the diet, a change in their diet and stuff like that. I'm just a bit confused because that's a very specific area that she's talking about there. There are papers that do look at the benefits of actual lifestyle changes, and the effects of that and the lesser risks of said diseases and all that with being in an ideal body fat percentage range and incorporating weight training and eating primarily whole foods. There's plenty of research that isn't on the kind of 5 to 8% of people diet cycling that shows the positive benefits of that, like less osteoporosis in women and etc. etc. I'll add them here if I have the time. But yeah, she's looking specifically on toxic diet culture. That's what I'm getting from this. She's looking at toxic diet culture, diet cycling, and the toxic, cycle of all that do encourage EDs. She's not looking at the broader picture. She's focusing on one very small focal point and making assumptions based on that. That's what she's doing, which I think is, it's just very, it's, I can't find the word, but it's not very professional. And she's a dietitian. Hi, it's Editing Mal here. I just wanted to say I have information processing issues. So a lot of the things that I see or take in don't really get fully established until the second time I'm going through it, or third, or whatever. And I'm just absolutely shocked at what I'm hearing here. So if you are listening to this and not reading the text pop-ups and the research that I am providing as evidence, she's basically confusing traditional approaches with ultra modern toxic crash diet approaches to losing weight, which using that kind of generalized and wrong language can be very harmful and dangerous for people who may not have the capacity to make their own research choices and look at what she's saying. So someone hears traditional approach, they're going to think, oh, calorie deficit and lifestyle modifications, that apparently has research where 95 to 98% of people who do that are unsuccessful. Can you see where I'm going here? She's giving a lot of misinformation, which is very concerning for a dietitian. I think she herself must have some form of bad relationship with her lifestyle or something like that, because this is absolutely fucking crazy.
We question the methods. We question all of this. We question this idea that people need to lose weight for their health. There is not a drug on the market that, if it had a 95 to 98% failure rate, would make it to market. There's just no way that we would look at a 95 to 98% failure rate and say, okay, well, clearly the person, the 2% to 5% of people who were effective on this, we need to look at what they're doing correctly so that we can, as if it's like a pump failing on the 95 to 98%, it not being effective. I could talk about this. Like, this was my expertise for years, and I pivoted away from it, and now I don't have my own business anymore, whatever. And I'm kind of in the mood to dig it back up because this is truly mind-boggling to me.
Yeah, bring it up. Like honestly, do bring this stuff up, because I do think it's important to talk about this stuff, especially with what's going on in the world. We're very much in a black and white community again. We're very much in a black and white area again, where there's either extremely skinny or extremely obese, and there doesn't seem to be any room for the in between. There doesn't seem to be. People can't seem to grasp the fact that people can just be in a quote unquote normal body, how humans come, how humans are meant to be, how people live both a happy and long life trajectory lifestyle. There seems to be no room for that. We're either extremely skinny or extremely obese, or then there's actually the bigger grey area, and a very kind of sore spot for a lot of activism community people is the kind of more weightlifting, powerlifting, weight training, fitter, leaner, not necessarily skinny, but lean, as in they have high muscle mass and lower body fat. They seem to hate those kinds of people, but they associate the extremely skinny with that area. There's some overlap, they think, because they just think that people like me who are reacting to this and have criticisms on health every size, they seem to think that that's what we want from them. We want people to be with big muscle and be really lean and work out 5 hours a day and eat salads and all that. That is not the case. That's a very specific area of people. I'm not I'm not weight training 3 times a week and getting 20,000 steps in and doing a 5K run. I'm not doing that so I can be big and muscular. I'm doing it because I want to reap the health benefits of when I get older. I don't want osteoporosis. I don't want the risk of arthritis. I don't want these things that are I don't want these higher risks. I want to lessen those risks because I've had medical trauma with my family members and such other stuff. I've witnessed how bad it can get. I've witnessed the absolute detrimental and traumatizing um, situations of that. So I'm trying to lessen that, but I also want to feel good in my body, and to be able to do that, I want to be able to feel strong and also have a lower body fat. I want to be able to see the hard work I'm doing. I don't want to be all. I don't want to be like muscle mommy and in the term that they see it as the activism community. I don't want to have these massive traps and all this. I mean, I have nothing wrong with that. I mean, to be fair, I wouldn't really have a problem if I did, but I'm looking for a very specific recomposition where I feel good in the clothes I wear. And I want to lower my body fat because I'm big chested. I've always been big chested, and it's been a hindrance in me. I have extreme social anxiety anyway, but I have literally actively not left the house because I cannot bear the size of my chest. Even with 2 sports bras on top of each other or compression on them, it's a massive insecurity of mine. So I'm taking control in my hands and saying, right, I would like breast reduction surgery, but before that, before doing such an invasive surgery, I would like to see if losing body fat will help resolve this. And if it does, but it doesn't do it in a way that I feel comfortable fully, then I will also get the breast reduction. But it lessens the risks there. It gives me an option. So that's my goals. That's what I want from life. I'm not trying to be this person doing strongman and all this. I'm just a normal, regular person who just wants to reap the health benefits of having a lower body fat or a body fat that's in the healthy range to lesser the risks of diseases that I've seen and have traumatized me, and I don't want to go through again, and I don't want my siblings or the people dependent on me to witness that. So that's kind of, sorry for that long-winded spiel, my God, but that's where I stand.
So much fat phobia is ingrained in the healthcare system. And I think this
Oh,
is
for sure. This is something we will talk about later, but there is definitely weight bias in healthcare, not just in the US, but in the UK as well.
really frustrates me about healthcare in general and people like, oh, healthcare is corrupt, healthcare is this, healthcare is that. But it's
Well, from what I've seen in America, the kind of health insurance system is definitely corrupt there.
who are rejecting science altogether.
Girl, this isn't science. This is commentary. I appreciate that you're making these comments and you're bringing up very valid arguments, but you're not backing yourself up because you've got this paper in the background, which is just an editorial commentary. There's no actual research in this. Oh, sorry.
Instead of looking at the nuance of peer-reviewed research, knowing how to read peer-reviewed research and saying, okay, well, let's follow the money and see what biases are showing up in each of these articles. I have read hundreds of peer-reviewed research
Well,
articles
why aren't you showing them?
about weight and health and, eating disorders and all of that, okay? And it requires nuance.
Of course it does. Everything requires nuance. Like, that's a given.
So yeah, this is what broke my brain, because fat activism, like, that is everything that you talk about in all these other social justice movements come up in fat activism. And fat activism is the one that people still are just not getting. Fat phobia is the one that people still are just not getting because of, the insane marketing. I'm coming off of watching the Him and Hers commercial, and I'm just like,
I don't know what that is.
so yeah, let me know if you want me to go into this more. I truly, truly, truly broke my brain.
Yeah, I'd love for us to go into it more. I'll just for the sake of time, I'll put a pin in it, and I'll come back to Whitney. I mean, this was 2025, so I'll come back to this when I can and see if she's actually done any. I should have done this before, really, but I had other things I wanted to talk about and this and that. I'll come back to it. I'll put a pin in it. I'll bookmark it, and we'll get back to that in another day. But yeah, so to sum it up, she didn't even really talk about this paper that much, but I think she's just using it as a primary example. She's saying that the research that for the scientific research that is predominantly used by people against the health exercise, healthcare in general, really. She's talking about healthcare. The people in healthcare that the research and the science that they use looks at what was it, 2 to 5%, 5 to 8%, or something like that. People who succeed after diet cycling, as in succeeding being that they kept the weight off. And they're using toxic diet culture as they're seen as a positive thing. Listen, I really struggle with information processing. I could be off the mark here. I watched it once, and because I'm an idiot and I'm pausing every 2 bloody seconds, I do miss things. So correct me if I'm wrong. That's kind of what I'm getting here. But let's actually get into the article here. I mean, this is just kind of an abstract, a summary of what it is. But my Wi-Fi must be down. Come on. Oh, well, that's just great. I was able to go on this earlier, but apparently it doesn't want to, so we'll just have to stick to this, like, very, um, this. Okay, so this is the article or paper that Whitney is talking about. So I'm just going to give a little breakdown. The main argument that these authors are saying, the claim that they're making is that obesity research often makes the assumption that weight loss is the most important outcome, but the authors make the claim that this assumption may be wrong or askew. So they argue that researchers instead should ask things like, are people healthier? What about their quality of life? Are they more physically active? Metabolic markers, are they improved? Are they experiencing actual harm from treatment plans? And do the patients actually value the outcomes that are being measured here? So they, after making that claim and arguing these questions, they kind of sum up weight should be considered one outcome among many, not the only outcome, which is kind of, this Whitney person is kind of, I think she started there, but then she's kind of gone off in a lot of different areas. So I'm gonna hold on, I've got my notes here. So I'm gonna kind of, what I'll do is, I've got it here. I'll go through each of the claims that they make, the points that they make, and then I'll argue them as we talk through it. So the first one is weight loss equals better health, and they believe that's an incorrect assumption, that it's not right. So that's not. So a clinician should agree that weight loss is not the same as health. Like it doesn't go hand in hand with health all the time, because somebody can lose 15 kilograms through EDs or malnutrition and neglect or severe illnesses, and someone can also improve fitness and insulin sensitivity or resistance and blood pressure while losing very little amount of weight. And they talk about how physical therapists can see this frequently within their patient reports, such as showing less pain, improved walking tolerance, better balance, and increased strength before any massive substantial weight changes occur. And therefore, weight alone is not it's an incomplete marker, is the term they use. So my counter argument is that, I mean, I agree that it's not the only marker, for sure, definitely. But my counter argument is this does not mean that weight is clinically irrelevant. Like larger prospective studies that are absolutely everywhere independently predicts with obesity and higher weight is type 2, you have a higher chance of getting type 2 diabetes, hypertension, sleep apnea, osteoarthritis, osteoporosis, fatty liver disease that's not associated with alcoholic fatty liver disease, several types of cancer, cardiovascular diseases, and that's even after adjusting for the physical activity and fitness of a patient. And the strongest evidence of that comes from bariatric surgery studies and GLP-1 receptor trials, long-term cohort studies, and Mendelian randomization studies. And kind of where I lie in the PT kind of nutrition perspective is weight should not be the only outcome, but it remains an important variable that influences biomechanics, metabolism, and disease risk. Like they're a very important physiological variable. That's where I draw my conclusion on that first point. Now, the second point in this paper, they talk about that patients care more about quality of life than weight. Agree, absolutely. Patients often say that they just want less knee pain, to be able to keep up with playing with their kids or grandkids, to be able to climb stairs, have improved fertility in some cases, reduce fatigue, and overall better sleep. And the authors argue that a patient-centered model should prioritize these goals, and instead of simply just weighing less. And I agree absolutely that that is what patients often care more about. I mean, quality of life, we're here to just be happy. That's what we want overall from life. So I do agree with that you don't have to have these massive substantial weight losses to have these improved fertility, to be able to climb stairs and play with grandkids, etc. And though a patient-centered model should prioritize these goals, many of these goals are themselves facilitated by reduction in weight, by losing weight. A lot of these things can be done by just having some form of weight reduction, and it doesn't have to be massive. So, for example, a patient that has osteoarthritis in a certain part of their body, let's say the knee, loses 10% body weight and often experiences significant reductions in pain and improves their overall knee function. And someone with sleep apnea may require actually less CPAP pressure after losing some weight. Or patients with PCOS frequently experience improved ovulation and fertility after even just a small or modest weight reduction. So my overall consensus of that claim is clinicians should frame weight as a means towards functional goals and not an overall aesthetic endpoint. So I do partially agree there, but many of these goals that the patients are going for, many of the things these patients want, are facilitated by weight reduction. So moving on to the third claim they make, lifestyle interventions improve health even without weight loss. And this is a very well supported agreement of lifestyle interventions improving health even without weight loss. And by that, I mean exercise improves your VO2 max, insulin sensitivity, and muscle strength or mood, and overall functions independent of weight change. So you can improve these things without a change in weight. So resistance training preserves your muscle mass, your lean mass, and improves function even when you're staying the same weight overall. And nutrition improvements can lower your cholesterol and blood pressure before any massive weight changes actually occur. Now, my counter argument to this is that the independent benefits do not negate like the added benefits of weight loss. Evidence suggests that exercise and a dietary modification or lifestyle modification and a modest weight loss can produce even greater improvements than exercise alone for many obesity related conditions. So an overweight patient with again, let's use the knee example, who have osteoarthritis in the knee. Let's say they lose like 8% body weight and perform strength training exercises, and they generally experience great pain reduction than just resistance training or strengthening alone. Clinical research over time increasingly supports like combining movement, nutrition, great sleep, appropriate weight reduction, and overall behavior changes when it comes to their lifestyle and their diet, rather than treating them as kind of competing philosophies. So that's where I stand there. So the fourth point, we're nearly halfway there. So the fourth point they make is researchers focus too much on like kilograms and BMI. And I agree in the sense that BMI has its limitations because it does not distinguish things like muscle mass, bone and fat distribution, or overall like cardio, respiratory fitness that your VO2 max can measure. But the limitations aren't that massively significant. For example, I agree that BMI does have its limitations, but that's only really when it comes to bodybuilders, for example, like a really muscular sports player and a person who has a very sedentary lifestyle and an office job. They may have identical BMIs because one is going to be obese, because of their fat distribution, and then another one's going to be classed as obese because of their high muscle mass. They'll have identical BMIs because of that. And when doing my PT training, it encourages you to routinely evaluate someone's gait, their strength and endurance, their actual quality of movement, and their functional capacity. Which is why I apply my own ideals for plyometrics in resistance training and calisthenics, because these predict independence and any disability. So my counter argument is that BMI does remain useful at a mass population level. It's inexpensive to do. You can do an online test, or you can do it at your local gym or GP. It correlates reasonably well with kind of body fat in most populations, like the average person, and it can predict disease risk across millions of people. So I do think BMI has its place, and we shouldn't abandon it, which is what a lot of activism people or health exercise people want. But instead, we combine BMI with waist circumference. I think waist circumference is the biggest indicator of better approach of measuring someone's health, body composition, actual physical functions, like a movement test, the metabolic markers in blood tests, and actual patient reported outcomes, rather than just replacing the measures entirely. We should be combining these approaches with BMI. Okay, so fifth, which is a very big argument, so bear with me. If you're still here, thank you. Weight-focused care causes harm. There is evidence here that is quite strong, because weight stigma, and we'll go into this later, this will come back. I might do like a two-parter video because this is going to be very long. So weight stigma, for sure, is associated with delayed healthcare seeking, avoidance of preventative screening, like pap smear tests, for example, or cancer screenings, increased cortisol, which is a stress hormone, hinge eating, depression, anxiety, and poor like patient and doctor or provider relationships. And patients do frequently report that they feel dismissed when a doctor or a nurse says, well, just lose weight, instead of receiving like a proper assessment. And this does represent poor clinical practice. I absolutely agree with that. I mean, there's a paper here that I read that the impact of weight bias and stigma on quality of care and outcomes for patients with obesity. And again, this isn't necessarily a massive like research. It's a smaller one, but it does look at patient reports and just provide evidence that the weight stigma is very much prevalent in the healthcare realm, and that it does become a kind of barrier or hindrance of for patients with obesity to have a great quality of care and good outcomes. So I'll leave that on there for you. But my counter argument is the solution to this is better communication, not ignoring obesity. And I think someone in the medical field, a clinician, would say you deserve respectful care regardless of your size. That's what a proper clinician should say. And reducing excess adipose tissue would likely improve certain things like joint pain, diabetes risk, and overall mobility. These statements are not contradictory. Like very weight neutral or patient neutral communication does not require kind of weight neutral sociology. So number 6, weight cycling proves weight loss approaches are harmful. And I agree in the sense that repeated restrictive eating with regain is associated with the frustration of it, a loss of lean mass, actual psychological distress, and disordered eating patterns. Many unsustainable diets fail. Unsustainable being the key word there. But my counter argument to this is that this criticizes poor interventions rather than intentional weight management itself. modern obesity management, it looks for gradual change, incorporating resistance training, adequate protein intake, behavior therapy and other therapies, long-term body maintenance, and if needed, and medication where appropriate, and obviously for select people, for minority people, like bariatric surgery. The goal is sustainable body composition change rather than just repeated crash dieting, which is why I have a few problems with what this Whitney person was saying, because she's saying that a lot of research is just based on this small percentage of people who succeed to continue their weight loss after crash dieting. But a lot of research actually looks at modern obesity management utilizing gradual changes, which is something I advocate for, resistance training, again, something I advocate for, adequate protein, again, and then the more psychological factors of behavior therapy and maintenance of mental health. So yeah, the seventh point that they make, the last point that they make, is health at every size is their framework. Woo! So you can look at, there's some substantial value in terms of respecting one's body, but I would argue that choosing obesity instead of maintaining a more sustainable and healthy weight and body fat percentage is a lack of respect. That's personally my take. That's probably not everyone's take in my realm of my community. But yeah, body respect. Reduction of stigma for sure. That's why I agree with in terms of health at every size. Being able to enjoy movement without feeling like they're being marginalised and don't fit in. Flexible eating for sure. Behaviour focused therapies instead of weight focused therapies, and avoiding shame overall. I agree with these statements. I agree with these points. I agree with these. These improve alliance and the adherence to actual of sustainable lifestyles. But I don't agree with the majority of health every size as a better framework, because I don't think they actually look at these aspects. Like body respect, I don't think a lot of it does look at that. And a lot of it is to do with cope, is a big cope under the guise of body positivity, which is why I criticise people who associate Factivism with body positivity, because often there's so much contradictory claims and terms there, So in terms of let's say a research perspective, like an actual clinical research perspective, the more controversial claim is that health can be achieved at every body size, irrespective of adipose tissue. But this is absolutely not this is not something we can reconcile with the current evidence. Like, interventional studies consistently show increasing risks with higher adipose tissue, diabetes, cardiovascular disease, osteoarthritis, sleep apnea, fatty liver disease. And recent studies in GLP-1 and trials demonstrate that intentional weight reduction improves blood pressure, inflammatory markers, liver fat, cardiovascular outcomes, and it suggests that actually reducing the adipose tissue itself contributes to improved health. So yes, let's say the statement that weight stigma harms patients, yes, that's strongly supported. People deserve respectful care at every size, absolutely, strongly supported. Health behaviours matter regardless of weight, absolutely. Weight is not the only meaningful outcome, absolutely, I agree with that. BMI is an imperfect measure, yes, I agree. Obesity increases disease risk, yes, absolutely, the evidence suggests that, and it absolutely shows that. You do not see people who are obese in their later years in life who don't have a massive list of medical issues. Intentional, sustainable weight reduction improves many obesity-related conditions. Absolutely, strongly supported. But weight should never be discussed clinically, which is what a lot of these health every size people claim. Not supported by the current evidence. Absolutely not supported. Body size is clinically irrelevant. No, not supported by current evidence. That I do not agree with. My PT nutrition philosophy in the training that I'm doing is that there is a nuanced position. A contemporary physical therapist, PT or nutrition professional can hold a nuanced position. And a lot of these people in the Factivism are wanting that. They're wanting reform of that. I agree with that. You should treat every patient with dignity and eliminate weight stigma. Absolutely. You should focus on function, pain, mobility, metabolic health, quality of life, and strength of a person, for sure. And you should use collaborative, patient-neutral and patient-centered communication and language rather than shame or moral judgments. You should recognise obesity as a chronic, multifactorial disease in which excess adipose tissue has genuine consequences. That's why I state. And we should view weight reduction when appropriate and desired by the patient as one tool among many, not the sole definition of success, but also not as something to be dismissed completely as unimportant or clinically invalid. That's sorry. So that's where I stand there. And because this has gone on for so long, I'm gonna stop the video here, and I'm going to continue the next part for the next video. So I'll have this edited and put up on Friday, and then have the other one on Saturday. And that's obviously in my local area, GMT+1. That's my area. So yeah, I hope you're still here, but thank you for watching, and stay tuned for part 2, where we will look more into weight stigma, healthcare system. I'll also be discussing the toxic behaviours and the issues I have with the kind of activism and health every size community. So stay tuned for that. Thank you, and thank you for watching or listening, and I'll see you in the next part. Bye.